and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Good morning, Minister. Thank you for joining us this morning. So this morning, I want to start with Budget 2021. I know the Ministry of Health would have been given a $53.5 billion allocation, and an additional 2.1 was given for COVID-19 response program and for critical items including medical supplies, test kits, sanitizing materials, and PPEs, plus a provision of $750 million to support the rolling out of COVID-19 vaccines. Firstly, what are your thoughts on Budget 2021 and your allocation?
I think, first of all, Budget 2021 is a very comprehensive budget because it covers all the sectors adequately. It caters for how to rectify the damage that we found in the sectors and what we can do, not just to rectify that, but to move the various sectors forward. I particularly like the measures that are implemented in the budget to address the concerns and the needs of poor people. And what is very good about the budget also is that it didn't impose any new taxes. So these are good features of a budget. As it regards to health, we are extremely pleased that we have been given such a generous allocation because, again, what this allows us to do is to fix some of the problems that we have in the sector, the challenges that we have, things like shortages of medicines, trying to get equipment for health centers and district hospitals and regional hospitals and so forth. These are ongoing issues that we have. And with this amount of money, we'll be able to rectify some of these problems. It's not going to solve everything, but certainly go a long way in fixing many of the problems that we currently have in the sector. So we are extremely pleased with the allocation.
Okay, thank you for that, Minister. Now, secondly, with respect to COVID-19, can you say what are some of the immediate equipment that the infectious disease unit needs, the Lilliendale, and what has already been procured?
Well, in terms of equipment, the things that you really need in this instance to deal with COVID-19 would be things like ventilators and monitors and so forth. We have an ICU at the Lilliendale facility where we have about 25 beds. We have a number of ventilators there, and we want to secure some more monitors. So with the allocation that we have, we will be able to get additional monitors to be utilized by patients who come there.
Okay. And can you say, I know we would have started the vaccine rollout last week. Could you say how many healthcare officials have taken the vaccine so far?
I don't have a complete number at this point in time, but I can tell you on the first day, we had about 318 persons who took the vaccine. And then the second day, I think we got about 350. They would have done some vaccinations over the weekend, so I don't have that number with me right now. But the uptake has been tremendously good. A lot of people came forward, they wanted the vaccine. And in fact, the amount of vaccines that we took initially, we ran out because we didn't cater for so many people coming forward. But we were able to quickly sort that out to make sure that everyone who came were able to get their vaccine. So we are quite happy with the response. I'm extremely pleased that a lot of the senior doctors at the Georgetown Public Hospital actually took the vaccine. You had persons like Dr. Foster Jeffrey, who is the head of the medical services at GPHC. He led his team by example, so he took the vaccine, and he did it at the Lilliendale facility. Dr. Bovell, who manages the hospital there, she also took the vaccine there. Coming back to GPHC, you had persons like Dr. Zulfikar Box, who is the head of the Accident and Emergency Unit. He also took the vaccine. Dr. Mahendra Karpin took the vaccine. He's the head of internal medicine at the Georgetown Public Hospital. Dr. Alexandra Harvey, who is the head of anesthesia at the public hospital. Dr. Marissa Sipasad, she is the head of pediatrics surgery, so she took the vaccine. So a lot of the consultant senior persons at the hospital, they took the vaccine, and a lot of the other doctors wanted to have the vaccine. So I think our challenge very shortly would be that we don't have enough vaccines for everyone at this point in time, which is a good thing to have, a good problem to have, because our expectations are by the end of the month we would be receiving thousands of doses of additional vaccines. And in that way, we would be able to roll out. And I think we'll have enough vaccines to cover at least all the healthcare workers. And then we'll move on to the other population groups.
Okay, Minister. Now, a question from the Guyana Chronicle as it relates to the vaccines. They're asking if you can provide an update on whether any health official that has taken the vaccine has had any adverse effects.
Not that I'm aware. As I keep explaining, side effects from vaccines would be basically two types. One set of side effects relate to the things that most people or some people would experience when they get a vaccine. And that is at the site where you got the injection, you might get a little bit of irritation, a little bit of redness, some soreness. Some people might experience headaches, a little bit of fatigue, fever. But all these are expected. And it shows that your body is reacting to the vaccine, which means that your immune system is probably working and starting to produce the antibodies that are necessary to fight off COVID. So that's great. And so that's one general type of reaction. And different people would experience different types of symptoms, but generally within a 24 hours, most of the symptoms would go. So there's nothing to be worried about there. And most of the persons who have received the vaccine would have spoken to these types of experiences. Then there's another group that is very, very, very rare. And these are called adverse events, meaning that persons can have some really bad reaction. In some cases, they're generally like anaphylactic reaction, meaning that the person develops some type of allergy to something in the vaccine. But if persons develop these types of reactions, generally it would occur within 15 to 20 minutes. And that is why when we finish administering the vaccine, we will keep the persons who receive the vaccine for at least 15 to 20 minutes under medical observation. And once everything is okay, we allow them to go. We then continue to ask them if they experience any signs or symptoms. They can report it. They're given how they can do so. And we have a national committee that has been set up to do what is called pharmacovigilance, meaning to monitor for any adverse event that might occur. And once we are able to detect it, we will then be able to explain to people how to resolve it. And in some cases, what actions to be taken and so forth. So far, we have not had any major adverse events. All we've had is these things that we expect, which is the site and soreness and so forth. With the particular vaccine, in the international literature, not much such events have occurred. So we continue to monitor.
Okay, thank you, Minister. Now, a Chronicle is also asking if you can outline how the ministry intends to engage health workers on various vaccines that we are expected to get.
Well, first of all, there's an education that we have to do. The types of vaccines that we're using, like in this case, the AstraZeneca vaccine, we have spent a lot of time explaining to healthcare workers the type of vaccine, how it works, and so forth, because the different vaccines work in different ways and they're made differently. Their efficacy is different, and so people need to understand that. The team that is working to do the immunization, they're well schooled in all the different things relating to the vaccine. And as part of the immunization process, there's a very strong education component. So anyone who come to get their vaccines would first of all go through several minutes of getting the right information pertaining to the vaccine. They're given a brochure with additional information on the vaccine. What is the vaccine? How it was made? What are the possible side effects you can get from the vaccine? Its efficacy, its safety. Who are eligible to use the vaccine? Who are not? Why is it that these persons are eligible, and so forth. So there are a whole set of things. So you're given that, and then if you get any side effects and so forth, and you want to report that, where you can report it. So when you go through that first step of getting this information, then you can make a decision whether you want to proceed, and then you sit down with the next person on the team, and they'll go through a checklist with you. That checklist is to verify whether or not you're eligible. And once they deem you to be eligible, then you go to the next stage where the nurse who is administering the vaccine would again talk to you about the process, remind you of the side effects, and then they administer the vaccine. And then you wait for 15 to 20 minutes to be observed to see whether or not there's any immediate side effects. And if there's none, you're free to go, with a reminder that you come back in 3 months' time, and you're given an appointment date to come back in 3 months' time so that you can get your booster shot.
Okay, so that brings me to my last question on this. The hesitancy survey would have showed that a percentage of health workers felt that they didn't have enough information on vaccines. So following the survey, were healthcare workers specifically informed and engaged on the AstraZeneca vaccine itself? I know you would have mentioned that they would have gone through the checklist and told about the side effects and so, but those are vaccines in general. What about the AstraZeneca specifically?
I think what you have to realize that the hesitancy survey was done probably about a month ago, a month and a half ago, when a lot of these things information were not widely available. It's only about, I think on Friday, that the AstraZeneca vaccine was formally approved by the WHO. We knew that the approval was coming because we participated in some of the meetings, and the strategic advisory expert group on vaccines met on the Tuesday of last week and give the green light for the WHO to use the vaccine. So when this survey was done, there were still many questions up in the air, and I think that's why you probably would find that there was a little bit of reluctance, or maybe people were not fully aware of what was happening with the vaccine. Things are moving so fast in this field that every day more information becomes available and new information becomes available. And a month can seem like a very long time with what is happening in science right now. So I think if we do a survey today, definitely we would see a big change in people's attitude, because, as I said, we were quite surprised by the amount of people who turned up and wanted their vaccines. And I think with the doctors taking the vaccines, nurses coming on board, and then they're reporting to their colleagues, that the attitude would be vastly different from what it was maybe a month and a half ago. So I'm optimistic, and we have seen this pattern in other places as well. So in the US, before vaccination actually started, there were persons who were reluctant to take the vaccine, but when the vaccine came to the institutions where they were working, a lot of people got in line and took their vaccines. So, we just want everybody to be safe. And we know that vaccines work. We have been using vaccines in Guyana for a long time. And we have seen how it has saved the lives of children. Right now we are using 18 different types of antigens to protect children from various childhood illnesses. And we have had remarkable coverage, sometimes between 95 to 98%. So vaccines are not new to Guyana, and we have been very good at using it. And therefore, using it against COVID is just another step in terms of protecting our population. So I really urge people, once you get the opportunity to get your vaccine, that you take it.
Okay, thank you for that, Minister. Now I want to wrap up today's segment with the COVID-19 vaccine education segment. So the Oxford AstraZeneca vaccine has been published in the medical journal The Lancet. Could you briefly explain why this is viewed as a major feat and its importance?
Well, The Lancet is a very prestigious medical journal, and it's peer-reviewed. So before you can actually get an article into The Lancet, you would have to meet all the scientific criteria. And it is, it's one of the standard bearers of medicine in the world. So when you have an article that is published there, people know that it would have gone through a very robust system of vetting, and that what is coming out there would stand scrutiny. And so when persons start seeing the results from various vaccine trials being published there, I think people were able to get their information and feel comfortable about the information they were receiving. In the case of the AstraZeneca vaccine, the results that were published point to some very interesting things. So the overall efficacy of the vaccine was deemed at 70%. But then when they actually did the full 2 doses, a full first dose and a full booster dose, they found that that was at 63%. When they did another subgroup, because they did these trials in 4 different countries, and in the UK, there was a subgroup where they gave the first dose as half of a dose, and then the second, the booster dose as a full dose. They found that those people who receive this dosing regimen, their efficacy was at 90%. And that is why when they average the 2 things, they were saying that the overall efficacy is about 70%. Notwithstanding all of that, what they have also found that initially they were recommending the vaccine to be first dose, and then after 4 weeks you get your second dose. But they found that if you actually waited a little while longer, that the efficacy goes up. And so now the scientific committee of the WHO has actually recommended that you should get that second dose sometime between the 8th week to the 12th week, right? And if you exceed the 12th week, don't wait too long after the 12th week so that you can get the vaccine, and the efficacy would be higher. So while the published results has been at 63, in fact, if you extended the interval between the 2 doses, that the efficacy is going to be much higher. And so the way that we are administering these vaccines here is that we have increased the interval using the WHO guidance. And so after the first dose, you'll get your booster dose at about 12 weeks' time. And based on the science that we have seen, the efficacy is going to be much higher than 63%.
Okay, Minister. And lastly, we spoke extensively about the side effects of the vaccine. But today we're seeking clarity on the AstraZeneca vaccine. Can this vaccine cause paralysis or, say, infertility? Because I know you had mentioned that there wasn't any study to show that pregnant women cannot take the vaccine.
Yes, so when you do vaccine trials, you try to select groups of people that you can administer this vaccine to. And with the AstraZeneca trials, they focused on the adult population, people 18 years and above. they didn't take a subgroup of pregnant women and administer the vaccines to them, and therefore they don't have any data pertaining to pregnant women or lactating women. However, because of the type of vaccine that is being used, the advice has been that if this pregnant woman is, say, a frontline worker working and being exposed to COVID, then that person would be at risk for COVID, and that the vaccine, the benefits of the vaccine, would protect her from getting COVID. And in those special circumstances, that the team that is administering the vaccine can weigh those benefits of the person getting the vaccine versus the risk. And if the benefits outweigh the risk, then they can administer the vaccine. And later on, now that they have started trials with pregnant women, we'll have the data soon enough. And so we'll be able to conclusively say whether women who are lactating and who are pregnant can get the vaccine. But this subpopulation, so far they have said that there really nothing to prevent a pregnant woman or a lactating woman from getting the vaccine. It's only an abundance of caution. That's why they're not recommending it.
Okay, thank you so much for that, Minister. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.